most leading cause of death in the world. And so regarding the introduction, so most of the cancers, more than 85% of the cancers and death occur in the low socio-economic status and also in the developing countries. So when compared to the developed countries, ovarian cancer is the most common concept, most common type. But in our country, CS cervix is the most common type. By the effective use of pap smear, that is the screening method for the detection of the CS cervix, we have reduced the rate of the cancer cervix by 80%. And the most common cause for the CS cervix is HPV virus. So use of the HPV vaccine also reduce the incidence of the CS cervix nowadays. So CS cervix is the entirely preventable disease. So by proper screening methods like by pap smear, VIAVLI, and by usage of the HPV vaccine, we have reduced the incidence of the CS cervix. So in over CS cervix is 3 cases. Regarding the demografic age is around 44, so it occurs in the younger age group. It's also in the old, so bimodal distribution. So it also age group but also the old age. And it is a who are not sexually active. So it is a common cancer in transmitted. Sexually active women, and it is most commonly associated with sexually transmitted disease also. The pathology occurs in the ectocervix in 80% of cases, and 20% cases it occurs endocervical. Ectocervical. Again, cancer or tube. So it is from ectocervix, and it will like this. Now, cervix in within the phonics also. In endophilic variety, it occurs in cervix, so that becomes bad. So depending on is the most common.
Hello, ma'am. Hello, ma'am. Hello, ma'am.
Hello. 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 Hello.
Yes, ma'am.
Am I audible?
Yes, ma'am.
Okay, able to hear now.
Yes, ma'am. கேக்குது ma'am.
Okay. So just when it is 12 o'clock, you have another class.
Yes,
Hello.
ma'am.
Pediatrics or some other class?
Medicine, ma'am.
Medicine. Okay. Just remind me. Okay, at 12 o'clock.
Okay, ma'am.
We will finish. Okay. So regarding the mode of the spread, it can extend directly. So to the adjacent structures. So what are the adjacent structures near the cervix? It is parametrium and paracervical and the paravaginal tissues. So it can extend laterally and up to the level of the ureter also it can involve, so that it may cause in advanced stages hydroureter. Posteriorly, it can spread along the uterosacral ligament and also it can involve the rectum also. So this is about the direct extension. And regarding the lymphatic extension, so the primary group involved in the CS cervix, this is again short notes asked in your exams. So what are the lymph node involved in the CS cervix? So the primary group of nodes are parametrial nodes, internal iliac nodes, obturator, external iliac nodes, rectal and the sacral nodes. So these are the primary group of nodes involved. Secondary nodes include common iliac group, inguinal nodes and para-aortic nodes. So what do you mean by sentinel node, lymph node? So sentinel lymph node is nothing but it is the first node that drains the primary tumor. In most cases, there will be only one single sentinel lymph node. And this node can be detected by intraoperative lymphatic mapping injection. That is usually the dye used is methylene blue. So this is about the lymphatic spread of the tumor. And third one is hematogenous spread. So it is very, very late only. So it occurs usually by veins rather than by arteries. So this is about the mode of the spread of the CS cervix. So coming to the symptoms. So what are the main symptoms? Usually their age, as I already told, and it occurs most commonly in the low socioeconomic status people. And menstrual history is the most important one. So what are the typical symptoms can occur? The patient either complains of either increased bleeding, that is menorrhagia, or intermenstrual bleeding or postcoital bleeding. So bleeding during defecation and all. So these are the important menstrual symptoms the patient may have. And the second one is offensive vaginal discharge. That is also very typical. So the patient may complain of, in advanced stages especially, the patient may complain of offensive vaginal discharge. And pain also can compare if it is a later stage, especially if the uterosacral ligament is involved. That may lead to backache and pain in the sacral plexus. Then edema of the legs also can occur in the advanced stages because of obstruction of the lymphatics and the iliofemoral veins. And some miscellaneous symptoms include bladder symptoms like frequency of the maturation, dysuria, hematuria can also occur. And if the rectum is involved, as in advanced disease, the patient may complain of diarrhea, rectal pain and bleeding and all. And sometimes because of ureteral obstruction, so lateral spread of the tumor may lead to obstruction of the ureter. So pyelonephritis, features of the pyelonephritis also can be present. So this is about the symptoms. And loss of weight and loss of appetite. So this is the most common symptoms. So irregular menstrual bleeding or excessive menorrhagia, intermenstrual bleeding, postcoital bleeding. So any patient complains of this type of abnormal bleeding, especially in the postmenopausal age group, you have to rule out CS cervix first. Then loss of appetite, cachexia, loss of weight, offensive vaginal discharge. These are the four cardinal symptoms of the CS cervix. And regarding the signs, so first you have to do, before going for provisional examination, you should do speculum examination. That is the most important thing. So the speculum examination, you can see the growth as a cauliflower-like growth, especially in the exophytic growth or any ulcerative growth. Also, you can see the so speculum examination is very, very important. Then you have to do pervaginal examination, that is bimanual examination. So it reveals so usually the cervix will be very friable. In the case of CS cervix, it will be invariably bleeds on touch. And if it extended into the vagina, you can see the induration, you can feel the induration, extent of the growth into the vagina. And the fornix also. So regarding the palpation of the fornix, if you see the lateral fornix, you can see again the induration. If it is involved, if it spread to the lateral pelvic wall, then you can see the induration and all in the fornix also. And the last one is rectal examination. That is also a must. So it is if the parameter is involved, you can feel the induration in the rectal examination also. And for confirmation of the diagnosis, biopsy is the must. So you have to take biopsy if you are suspecting any. So if during screening stage also, while doing pap smear or via villi, if you are suspecting any lesions, then you have to take biopsy from that area. So punch biopsy can be taken or wedge biopsy can also be taken. So if it is obvious ulcerative growth or cauliflower-like growth, you can take biopsy from the wedge biopsy can be taken. So biopsy is the confirmatory diagnosis. So usually staging of the CS cervix is usually done by the clinical staging only. So what is the purpose of staging? Why you are staging the disease? So it is usually staging is done to determine the prognosis of the disease and to formulate the line of the treatment and to compare the results of the that. So for staging, usually CS cervix is the clinical staging only. But so when we studied, it is purely clinical, but now they included CT, MRI also in the staging. So what are the investigations you have to do before staging of the disease? So apart from clinical examinations, what are the other investigations you have to do? So cystoscopy to detect the bladder involvement, and X-ray chest, and intravenous pyelography, proctoscopy, ultrasonogram, CT abdomen, MRI abdomen, and PET CT. So the latest diagnosis is the PET CT. So these are the additional investigations you have to do. So MRI. So why you are doing MRI? So to know the extent of the tumor size, tumor and bladder involvement, rectal involvement, parametrium involvement can be done, detected by MRI. And CT is taken to detect the nodal status. So how the lymph node is involved, it can be detected by CT. And PET is superior to CT or the MRI for detection of the lymph node metastasis. So this is about the investigations for staging of the disease. Once you do investigations, then you have to stage the disease. So depending on the stage, it is divided into 4 stages, stage 1 to 4. So stage 1 is, what is stage 1? So usually this, stage 1 is the CA cervix, the carcinoma is strictly confined to the cervix only. So it is again divided into stage 1A and 1B. So what is 1A? So 1A is nothing but it can be diagnosed only by microscopy with a maximum depth of less than 5 millimeter invasion. 1A is again divided into 1A1 and 1A2. So if it is less than 3 millimeter, it is A1. If it is between 3 to 5 millimeter, it is A2. So what is 1B? So it is again, so involvement of the cervix only. So invasive carcinoma with deepest invasion of more than 5 millimeter. So there in stage 1A, it is less than 5 millimeter. Again, is divided into 1A1 and 1A2. 1A1 is less than 3 millimeter and 3 to 5 millimeter is 1A2. 1B is more than 5 millimeter. So again, 1B is divided into B1, B2 and B3. So what is B1? So B1 is, if it is more than, microscopically, it is more than 5 millimeter invasion, and macroscopically, it is less than 2 centimeter. 1B2 is macroscopically it is between 2 to 4 centimeter, and 1B3 is more than 4 centimeter. So this is about the stage 1. So stage 1 is the CS cervix confined to the cervix only, and depending on the microscopic or macroscopic involvement, it is divided into A and B. A is microscopic involvement, B is macroscopic involvement, and depending on the size of the disease, again subdivided into 1A into 1A 1N 1A2 and B1 B2 B3. And regarding the stage 2 is the carcinoma extend beyond the uterus, but not extended up to the lower one third of the vagina or to the pelvic wall. So it is extended beyond the uterus, but it not extended up to the lower one third of the vagina or into the pelvic wall. So what is stage 2A? So it is upper two third of the vagina is involved. Stage 2A1, again 2A is divided into A1 and A2. A1 is less than 4 centimeter, A2 is more than 4 centimeter. And 2B is with parametrial involvement, but not up to the pelvic wall. So 2A is without parametrium involvement, 2B is parametrium is involved. Stage 3, so here the cervix carcinoma involves the lower one third of the vagina. It may or may not extend into the pelvic wall and causes hydronephrosis or non-functional kidney, or it involves the pelvic and the parietic lymph nodes. This is again divided into A, B, C, and C is divided into C1 and C2. So A is, so what is stage 3A? So it involves the lower one third of the vagina without extension to the pelvic wall. Stage 3B is pelvic wall is up to the level of the pelvic wall is involved. It causes hydronephrosis. And stage 3C is involvement of the pelvic or the parietic lymph nodes. So it is only the pelvic lymph node is involved, it is stage 3C1. Parietic lymph node involved, it is stage 3C2. And 4 is the cervix extended beyond the true pelvis and involved the mucosa of the bladder and the rectum. It is again divided into 4A and 4B. So 4A is, it is adjacent pelvic organs is involved. 4B is distant organs is involved. So this is about the staging of the figure staging of the CS cervix. So you have seen symptoms, signs, and investigations, and staging of the CS cervix in short. The last one is what is the treatment and the differential diagnosis. So differential diagnosis of CS cervix, it may be CA tuberculosis, cervical tuberculosis, syphilitic ulcer or cervical ectopy. Even products of conception in the incomplete abortion can be misdiagnosed as CS cervix, and fibroid polyp that extend into the vagina. So these are the 5 differential diagnoses of the CS cervix. So what are the complications can occur in the CS cervix? Hemorrhage. So foremost one is hemorrhage because of bleeding cervix, and ureteric pain because of pilates, pyelonephritis if the urethra is involved. Pyometra can occur if it involves the endocervical canal. Vesicovaginal fistula, rectovaginal fistula if it involves bladder and the rectum can occur. Usually the cause of death in CS cervix is due to uremia. So ureter involvement, pyelonephritis, uremia causes the death. Hemorrhage, sepsis, cachexia and metacyst also can cause death. And prevention of the CS cervix, as you know, screening of that is a entirely different topic. So it can be screening. Proper screening is very important nowadays. Liquid-based cytology, via villi, and Pap smear also done, even at the PSA level to prevent the CS cervix. So any abnormal areas has to be taken for biopsy, and prevention is better than cure. And prophylactic HPV vaccine also given to prevent CS cervix, especially in sexually active reproductive women. So regarding the mode of the treatment, so in simplified terms, so it may be surgical or radiotherapy, unless otherwise in other cervix, other carcinoma, CS cervix, the main radiotherapy is highly effective. So surgery can be done only up to 2A, stage 2A can be done. So after that,
it is better to go for radiotherapy rather than for the surgery. So up to 2A, the surgery can be done. So what are the types of hysterectomy? So they usually Rutledge classified the radical hysterectomy into 4 classifications. So depending on the stage, we have to do the surgery. So in short, it is up to 2A surgery can be performed. In stage 1A1, so we are staging the disease for the treatment purpose only. So in stage A1, it is a microinvasive cancer. So if it is a very young woman, if she wants to conceive, then fertility preservation surgery can be done. That is cervical conization and close follow-up to be done if we are doing that procedure, or modified radical trachelectomy can also be done. So this is about the young women with stage 1A1 disease. At the same time, stage 1A disease, patient is completed her family life, then you have to go for either total extrafacial hysterectomy or modified radical hysterectomy with pelvic lymph node dissection. So this is about the 1A1. So if it is a very young woman want fertility preserving surgery only, you can do cervical conization or trachelectomy. In stage 1A2, again the modified radical hysterectomy alone or done, or is again divided into low risk cases and high risk cases. So low risk cases only modified radical trachelectomy or modified radical hysterectomy with pelvic lymph node dissection can be done. In advanced stages, in other cases, either radical abdominal hysterectomy or vaginal hysterectomy can be done. So it is a radical hysterectomy or again modified radical hysterectomy with pelvic lymphadenectomy can also be done depending on the staging of the disease. And in stage 1B and in 2A also, surgical treatment is preferred. So again the treatment is type 3 radical hysterectomy. So type 3 radical hysterectomy with pelvic lymph node dissection is done, or otherwise modified radical hysterectomy with pelvic lymph node dissection can also be done. So in stage after that, stage 2A, radiotherapy is the best when compared to the surgery. So this is about, in nutshell, about the CA cervix treatment, investigation and staging. Okay. Any doubts? Hello? Hello?
No, ma'am.
Okay. Shall we end up the class? Okay.
Yes, ma'am.
Okay.
Thank
Thank
you.
you.
Thank you, ma'am.
இப்போ ஆடிபிளா இருக்கா? ஹலோ, ஆடிபிளா? நவ் இட்ஸ் ஆடிபிள். கேக்குதா? சவுண்டு கம்மியா இருக்கா? இப்போ வால்யூம் ஓகேயா? ஹலோ, ஆ சரி சரி. ம்,
ஹலோ சார்.
இப்போ வால்யூம் ஓகேயா? வால்யூம் கேக்குதா?
சார் கம்மியாக தான் சார் கேட்குது.
ஆடிபிளா இருக்கா? வால்யூம் கம்மியா தான்
இல்லை
இருக்கா?
சார். ஆ
இப்போ வால்யூம் வால்யூம் கேக்குதா? நல்லா கேக்குதா?
இல்லை சார், ரொம்ப லோ.
இல்ல சார், லைட்டா தான் சார் கேக்குது.
வால்யூம் கேட்கலையா? நல்லா கேட்கலையா?
ஆமாம் சார்.
நோ சார்.
ஆடிபிளா இருக்கா? ஆடிபிளா இல்லையா? நாட் ஆடிபிள்.
ஆடிபிளா இல்லை சார்.
ஆடிபிளா இல்லையா? இதுல உள்ள ஹலோ ஹலோ ஹலோ, வால்யூம் ரொம்ப குறைவா இருக்கா? வால்யூம் ரொம்ப குறைவா இருக்கா? ஆ கேக்குதா?
இல்ல சார், லோவா தான் சார் கேக்குது.
ஹலோ. ம்.
ஹலோ சார்.
போன போன்ல இருந்து பேசுவா. இத ஸ்லைட இதுல இருந்து பண்ணிட்டு போன்ல பேசுற மாதிரி பண்ணுவா. சரி சரி. இதுல இருந்து இப்போ ம்.
ஹலோ சார். ஹலோ சார்.
ஆ ஆ
சார் ஸ்டாப் ஷேரிங் கொடுத்துருங்க சார்.
ம். இப்போ கேக்குதா?
கேட்குது சார்.
இப்போ கேக்குதா?
கேட்குது சார்.
ஆடிபிளா இருக்கா?
எஸ் சார். சார் கம்ப்யூட்டரில் உள்ள மைக் ஆஃப் பண்ணிடுங்க சார்.
இப்போ ஆடிபிளா இருக்கா?
எஸ் சார்.